User friendliness is central to Genodyne. Genodyne's Accelerate Negative Pressure Wound Therapy has an easy one-touch startup system. Easy to read display shows the rate of negative pressure as prescribed by the doctor. To increase or decrease the prescribed pressure, push up or down on the centrally located arrows. To lock the keypad, press and hold on the lock and exit buttons for approximately 8 seconds. The unlock icon will change to lock, and the keypad will be disabled until unlocked again. In the right-hand lower corner, it shows the system status. Green check mark shows that the system is good. This shows actual negative pressure being delivered to the wound bed. Battery indicator is in the upper right-hand corner. Plug in the charge cord for charging. It takes 3 hours to fully charge up. When the unit is plugged in, the lightning bolt will appear, and the battery indicator will indicate charging. The charge will last for approximately 8 to 10 hours. The light on the charge cord will illuminate, indicating that you are plugged into an active electric outlet. The Genodyne wound vacuum system is indicated for patients who would benefit from negative pressure wound therapy to promote wound healing by reduction of tissue edema, decreased bacterial levels, provides mechanical stress, promotes vascular perfusion and blood flow, helps granulation tissue formation by facilitating cell migration and proliferation. The Genodyne's green foam, with its non-adherent property, is opposite and the color wheel is red, and therefore shows up better in the wound. Less likely to leave any pieces behind in the wound bed. Our highly porous, open reticulated polyurethane foam is hydrophobic. It doesn't absorb exudate, but allows for it to be removed from the wound bed in order to provide for a moist wound healing environment. Genodyne also provides in the dressing kit an oil emulsion dressing to lay down over bone or tendon in the wound bed to prevent direct contact with foam. Skin prep for protecting the wound edges, Q-tips with a measuring device, ostomy paste for that difficult area to seal. Genodyne offers 3 different size canisters, 200, 400, and 600 cc's, depending on the amount of exudate. The Y connector is available for bridging more than one wound. Genodyne's proprietary drape is easy to use. It's see-through for tracing around wound edges. It makes application a breeze. Start with skin prep. Apply it around peri-wound skin for protection. Allow it to dry. It also helps in increased adhesion of the drape. Cut drape to proper size to window pane around wound bed to protect the peri-wound skin from suction damage. When applying the drape, make sure the 1 and the 2 side is down. Trace your wound edges. Cut out your pattern. Apply around the total edge of the wound. Place cut green foam to fit in the wound bed. Do not overstuff the foam. Place appropriate size drape over the area to seal with approximately 2 to 3 centimeters extended beyond the wound edges. Open the wound vacuum carrying case and connect the appropriate size canister to the wound vacuum system. Click it right in place. Attach the screw and connector from the canister to the port dressing. Make sure the clips on both sides of the connection are open. Choose the port dressing application site. Cut quarter-size round hole and then apply the port dressing. Pull the backing off of the port dressing and place over the open area. Remove backing stabilizer. Remove handler strip. Turn the Genodyne wound vacuum on. It will draw down slowly for a virtually painless application. Run fingers around edges to ensure the adequate seal. Be cautious not to apply port dressing over pressure areas. Bridge away from pressure areas whenever possible.